An ingrown toenail occurs when the edge of a toenail grows into the surrounding skin, causing pain, swelling, and sometimes infection. It most commonly affects the big toe but can occur with other toenails as well. Here's a comprehensive guide on ingrown toenails. Symptoms: pain often starts as mild discomfort but can become more severe. Redness: the skin around the toenail becomes red and inflamed. Swelling: the area around the toenail swells and may feel warm. Tenderness: the toe becomes sensitive to touch. Infection: if an infection develops, there may be pus or drainage and a more intense pain. Causes: improper nail trimming. Cutting toenails too short or rounding the edges can lead to ingrowth. Tight or poorly fitting shoes. Shoes that press on the toes or are too tight can cause toenails to grow improperly. Genetics: some people may have a genetic tendency to develop ingrown toenails. Injury: trauma to the toenail, such as stubbing your toe or dropping something heavy on it, can cause ingrowth. Toenail shape: naturally curved or thick toenails may be more prone to ingrowth. Risk factors: nail trauma, repeated trauma to the toenail from activities or accidents. Footwear: wearing shoes that don't fit properly. Hygiene: poor nail care and hygiene practices. Foot structure: certain foot deformities or structural issues can contribute to ingrown toenails. Diagnosis: diagnosis is usually made based on physical examination. Healthcare provider will examine the toe to assess the severity and determine the best treatment approach. Medical history: discussing any recent injuries, footwear choices, or previous episodes. Treatment: treatment depends on the severity of the ingrown toenail. 1. Home care for mild cases. Soak the toe. Soak the affected toe in warm, soapy water several times a day to reduce swelling and relieve discomfort. Use antiseptic. Apply an over-the-counter antiseptic to prevent infection. Wear comfortable shoes. Choose well-fitting shoes that do not put pressure on the toes. Lift a nail. Gently lift the edge of a nail and place a small piece of cotton or dental floss underneath to help it grow above the skin. 2. Medical treatment for moderate to severe cases. Antibiotics: if an infection is present, healthcare provider may prescribe oral or topical antibiotics. Nail trimming or removal: in cases where home care is ineffective, the podiatrist may trim or partially remove the affected portion of the toenail. Nail splinting: applying the splint or using special tools to lift and reposition the toenail. 3. Surgical treatment. Partial nail removal: in more severe or recurrent cases, healthcare provider may perform a minor surgical procedure to remove part of the toenail and prevent regrowth into the skin. Matrixectomy: for chronic cases, a procedure to remove a nail matrix, the tissue that produces a nail, may be performed to prevent a nail from growing back. Prevention to prevent ingrown toenails. Trim toenails properly. Cut toenails straight across and avoid rounding the edges. Wear proper footwear. Choose shoes that fit well and provide adequate room for your toes. Practice good foot hygiene. Keep feet clean and dry, and avoid trauma to the toenails. Avoid self-treatment. If you experience recurring ingrown toenails, consult healthcare provider for appropriate treatment. When to seek medical attention: consult healthcare provider if severe pain or swelling. Symptoms are severe or worsening despite home care. Signs of infection: there is significant redness, swelling, or pus. Recurrent ingrown toenails: you have frequent episodes or chronic issues. Difficulty managing: you are unable to manage the condition with home remedies. Conclusion: ingrown toenails can be painful and uncomfortable but are usually manageable with proper care and treatment. If you experience symptoms of an ingrown toenail, taking prompt action to address the issue and seeking medical advice when necessary can help alleviate discomfort and prevent complications.